not familiar with the Long-Term Care Community Coalition, we are a nonprofit, nonpartisan organization, and we're entirely dedicated to improving care and quality of life for residents in nursing homes and assisted living. We are also the proud home to 2 local long-term care ombudsman programs in the Hudson Valley of New York State. Today's webinar, which I'm really excited about, actually, sorry, that's my dog. Uh, okay, hopefully she'll calm down in a second. But I'm really excited about today's webinar. It really comes from a program that I attended at the National Consumer Voice for Quality Long-Term Care, their conference last year in San Francisco. And it was a terrific conversation with residents. And we so often, at least, those of us who are working on policy, et cetera, of course, we're always thinking about the residents and the impact of those policies on and practices on residents. We're not always speaking to residents. And I was just really so impressed and moved by the conversation that the Consumer Voice hosted, that I invited them back, I invited them to come today and speak to us and converse and discuss some of the issues that are affecting them and their lives. And again, we'll have time hopefully for Q&A at the back at the end of the program. Right now, I'm going to hand it over to Sam Brooks. Sam Brooks is the policy director of the National Consumer Voice. He is a extremely knowledgeable person and a force to be reckoned with. And when it comes I'm looking at Sam and we're laughing, but Sam is really one of the smartest people I know and certainly one of the most dedicated. And I'm so excited that he's here with our guest who he will introduce. But thank you all for joining us today. I'm talking about our panel. And of course, thank you all for our guests for joining us today. And I'm going to stop sharing so you can see everybody. Thanks, Sam.
Thank you, Richard. You're too kind. And ditto back at you. It's really an honor to be here with LTCCC. Do such amazing work, and I'm really glad to be here and be a part of this conversation today. Again, my name's Sam Brooks. I'm the Director of Public Policy at the National Consumer Voice for Quality Long-Term Care. We work side by side with Richard and Haley and others from LTCCC to try to implement better policies for folks receiving long-term care. And one of the great luxuries, or one of the great experiences we have of doing this, is getting to work with consumers themselves. Today we're going to be having a conversation with 3 residents from nursing homes, and 3 of my favorites. And I wanted to Maurice is going to be here a little late, so we're going to start off first just introducing each of them. And Cindy, why don't we start with you? Can you tell folks your name and where you're from, and where you're living, and how long you've lived in long-term care?
I would love to, Sam. My name is Cindy Napolitan. I have lived in long term care for over 7 years. I was diagnosed 35 years ago with MS. My daughter was diagnosed 10 years later at the very young age of 20. She lives with me, she is my roommate. We've been together for 7 years, like I said. My husband was our caregiver. When he passed away suddenly, we had no choice but to go into long term care. It has really been a challenge for us and for all the residents that live in this home. I live in the Dallas, Texas area. It is it was a 5-star nursing home when we moved in. It is now a 1-star nursing home. There are daily challenges with everything. But I appreciate you joining this webinar today, and I hope that you listen very carefully, because if it can happen to me and my daughter, it can happen to anyone. So thank you for joining.
Thanks, Cindy. I really appreciate having you here. Um, And next we have Ray DiFrancesco. Ray, do you want to introduce yourself?
Sure. So I'm Reggie Francesco. I live at Carnegie Post-Acute Care in Princeton. I have been here almost exactly 3 years now, which is kind of an odd anniversary to think about. Um, my situation here is I'm very active with the group here in the nursing home. I work a lot of work on the state coalition here and recently have joined National Consumer Voices Leadership Council. So I think that, Cindy, myself, and other people from National Consumer Voice have monthly meetings with other residents around the country and in our facilities. So you're going to hear our perspectives, not only personally, but from other people we live with.
Thanks, Ray, and thanks, Cindy. And hopefully Maurice will be able to join us soon.
Yeah.
So we thought about a couple topics that we could talk about that really somewhat I don't want to say typify, but demonstrate or illustrate what it's like living in a nursing home. And I wanted to start off with something that Richard alluded to earlier: personal needs allowances. And for those that don't know, if you're living, most people who live in nursing homes long term, no, that's over, a few months, have their stays paid by Medicaid. For those individuals, how it works is generally all the residents' all of the residents' income goes to the nursing home. And then the state pays the remainder. So residents are paying for their care. And the state is essentially supplementing those payments. There is what they call a personal needs allowance. And that is just somewhat what it sounds like. It's an annual amount that residents are able to keep from their own money to provide for their personal needs: clothes, entertainment. And what you'll see, and what we'll talk about today, and I'm going to turn it over to Ray in a second, is that these amounts vary, but since implemented, the amount hasn't changed. Federal amount hasn't changed. $30 is the federal amount. States are provided the opportunity to provide higher amounts. Some states do, but there still are states out there where residents are only allowed to keep $30 of their money. Ray, I want to start with you. You have a personal needs allowance. Can you talk about what you use it for, and how it affects your ability to function in a nursing home and in the
Sure.
community?
Yeah, I mean, I think it's amazing because I live in New Jersey, one of the most expensive states to live in, and we get a whole whopping $50 a month. And it's really amazing that how anyone can think that we can live on $50 a month, because I talk to a lot of people actually out in the community, and I start talking about P&A as I did at a church breakfast on Sunday, and they think we get everything paid for. And when I start telling them is no, we don't get clothes, we don't get shoes. How about a haircut? The quality of a lot of the materials we get is extremely poor. So, you really have to buy your own shampoo. You have to buy your own mouthwash. I mean, we don't even get things like cough drops included with our stay here. So if you really want to buy your clothing or simple things like, let's say, going to a movie, that's a major outing. And buying a new pair of shoes is a major event. So we here started about a year and a half ago what we call our thrift shop. So we take clothes that people have been donated here. We ask staff and friends for clothes. So once a quarter, we do a thrift shop where people can get clothes for free, which is great. But then we joke is, we wear our dead neighbor's clothes. And we kind of talk about it too. We're like, oh yeah, that was Edith's top. So we try to make light of it, but it really is trying to stretch that cash from $50 for the month. And especially, we don't get sales. We have to go to vending machines. We have to buy from catalog. we can't go out for many places and go shopping. So we're really constrained by not necessarily the $50, but how we can spend it and where we can spend it. So it really is a challenge for us. And one thing when we're ready to is New Jersey is in the process of trying to up that amount to $140 a month. But Cindy will tell you about her experience, and maybe we can come back and I can tell you some of the activism we're doing in New Jersey around PNA.
Great. Thank
Cindy?
you, Ray. Yes, I live in Texas, and at the first of the year, ours was increased from $60 to $75 now is what we get. And what that means is that every income that you have, the nursing home gets everything from you, and you're left with $75 for the entire month. Again, I spend my money on toiletries, the shampoo, the toothpaste, whatever you need, because the quality of what they offer here is not that good. You even have to buy a toothbrush. So $75 does not go very far. If you want to go and maybe have somebody pick up a hamburger for you somewhere, I mean, the prices of groceries these days, we used to be able to go and buy something at a local hamburger place and just spend maybe $7. Now, if you want to go out and get something from a hamburger place, you have to spend $15, $20. So, and being able to do that at least maybe once a month is a huge treat. But the PNA across the board, some states, like we said earlier, are only getting $30 a month. Our state legislature is the one that increased our amount. We didn't go through federal means, we had to go through the state and got an approval. So, and people have to actually call their legislators and try to get that to happen. It's not something that they're automatically going to do. You have to get people involved and people that want to get that amount increased. And it takes years. It didn't just happen overnight. It takes years to get that done. PNA is something that people they need. There's no way to get clothing, like he said. Again, we are getting clothing from people that have passed away, or from family members if you're fortunate enough to have a family member. And Ray, also, you talked about the ways that we can order our clothing or our essential items. We are fortunate enough to have computers that we can go online. We can go to the various stores and buy something and have it delivered to our homes. Most of my residents here don't have computers. They may not even have family members that can go out and shop for them. So it's extremely difficult to watch your neighbors not get anything. So we usually get stuff during the Christmas holidays when people are more generous and they'll donate things. But for most of the residents here, they have nothing. You see people walking around or in their wheelchairs with no socks on their feet in the winter. And you just feel for all these people that don't have the essentials that everybody has. And it's a very sad situation.
Yeah, and
People,
Cindy, yeah, and you talked about it, is it takes a long time to get these dollar figures moved up because we have to do it on the state level, because I don't think the feeling is we're going to see anything happening on the federal level, right? So what we started doing in New Jersey is one of our residents, Stacy, decided that this wasn't fair. So she actually helped write the legislation that is now going through the New Jersey. So we've gone through the legislature and the Senate's first couple committees, and we got it approved. But what the CEP program, which is the the community engagement program in New Jersey has done is we've amplified residents' voices. So we've testified in front of the Assembly and Senate in person and writing. We've gotten petitions throughout the nursing homes. We've shot little videos of how people use the PNA, and we're now sending it out on social media. And the exciting thing is, even though these tough times, we actually got a meeting with the governor's office for next Monday
Wow.
with I think 3 or 4 residents to go in there and tell our story.
That's
So, it's a really exciting thing to happen, but it's so needed. It really is just
absolutely.
it's not like you're giving your kids some allowance,
Right.
It's a whole different need here.
And that a group of
Sorry, go ahead.
residents is doing that is amazing. And it shouldn't be a group of residents that have to do that. It should just be something that people just feel that should be done for people. I mean, you're fortunate enough that you can be able to do that. But again, most people in nursing homes aren't able to do that for themselves. So congratulations. I hope it goes
That's-
through quickly.
Thank you.
That is great. Thanks to you both for sharing that. One thing I should point out, last year, that there was some federal legislation introduced that would have raised the personal needs allowance, I think, to $60, and then have tied it to inflation, so how every year folks who get a cost of living adjustment for their Social Security, still not enough, right? And still certainly could be improved. But it's something I think that resonates with the public when you hear just how, and Ray, just coming back a little, how isolating a PNA is. People can't afford to leave. We wonder why we don't see more nursing home residents out at museums or at the movies or at restaurants. It's because you can't afford to, right?
Yeah, I mean, going to a movie, is $12. And if you want popcorn, that's another 10, right? If you really want to go anywhere, then you do have to want to spend some money. So, even if you want to go out, if you want to pick up a soda or an ice cream or something, then you still need to have some money to spend. And even a lot of times you can get into certain places, like museums and stuff for free, but still your nursing home has to have transportation. And a lot of nursing homes, I live in a nursing home and they own 8 different nursing homes. We're the only one that has our van, and the only reason we do is because we're attached to an assisted living facility.
Wow.
Amazing.
Yeah, we don't have transportation available. We have 2 vans, but they're only used for medical transport to doctor's appointments. I am fortunate that the administrator will allow me to use it on occasion. But for most people, they're just stuck here. There's nowhere to go and really nothing to do.
Isolated, right?
Very
Isolated
isolating.
from the rest of us.
Yes.
Again, I think you should see all the comments in the chat about how supportive people are. And one thing I love about you and Ray and Cindy is that they don't talk about themselves. They talk about their fellows more, their neighbors in the facilities more than they do themselves. So I'm really grateful for that. I want to move on to another issue that I think a lot of people don't know about is our grievance systems in the nursing homes. I think folks who are familiar with nursing home care understand you can file a complaint with your local survey agency, which is often the Department of Health, and we know how successful those are. We know how exactly. I'm using a little bit of irony here, but there's also the requirement that nursing homes have grievance systems, and these are systems that are set up to hear either complaints about care or other services about quality of care, either from directly or indirectly, anonymously from nursing home residents. And I think it's
Mhm.
something that we don't focus on enough, and we don't hold facilities accountable enough for. And I wanted to start with you, Cindy. Does your facility have a grievance system, and have you ever tried to use it?
Oh, absolutely. We have a grievance system. It's called a grievance form. Um, they are supposed to be available outside of the activity director's office. However, this morning I did notice that it was empty. So I will have to go after this meeting and make sure that it's filled up. You can, if a resident's having any kind of issue, say they're not getting their showers, they're not having their call lights answered promptly or at all. Sometimes our call lights aren't answered for hours. So if somebody's laying in their bed, even if they are in pain and they need a pain pill, they will turn their call light on and then wait for somebody to answer it. And again, this is something to do with lack of staffing too. So you wait, and no one comes. Finally, maybe after an hour, hour and a half, somebody does answer, and you simply want your nurse. Our call light system isn't like a hospital system where they will answer you and you can tell them what you need. There's just a light that goes on outside of your room. You have to wait for somebody to come and let them know what you need. So if you need a pain pill, or if you need something picked up off the floor, if you say you drop your call light and there's no way for you to let anybody know that you need help, these are all serious things. People fall out of bed, they they're injured, they're bleeding, and there's no way for them to get help. So when that happens, you fill out a grievance form. You can ask anybody in the building, any staff member to help you fill it out. So again, it's not anonymous. So if you have to ask a staff member to fill it out, then they're going to know who's got the issue, right? Unless you're able to write it yourself. Um, and what happens is it gets turned in to our social worker, and you detail what the issue was, the time of day, what happened, who it happened with, and it's supposed to be responded to within 3 days. I have never had one responded to in 3 days. I have had to wait for our survey agency to come and do their survey, which right now we're in our survey window. So I have grievances that have never been answered. Last year, when they came on March the 22nd, I had about 7 of them that had never been answered. So I brought them to the investigator and got my answers. But by that time, it was too late. I mean, you can do one every day and it still doesn't get answered. A lot of our residents have just simple things like missing clothing, lost and found items that, that we don't even have. We've been asking for lost and found area. We haven't been able to get that done. So during our resident council meetings, we can talk about our grievances, like not getting our shower, not getting our food, not getting our medication on time. That is a huge issue. Sometimes our medications are 2.5 hours late. And then they want to turn around and give you your next medication an hour later. Well, that's a dangerous situation. I can't take my meds that close together. So that would be a personal grievance that you would write up. And again, it may or may not get handled. We never hear what's going to happen. So for
Sounds
me,
frustrating.
it's a useless situation. It's a useless system as well. What about you, Ray?
Yeah, Ray, what about you?
Well, first of all, I have to echo everything Cindy said. So I'm going to have to cover different things, but we have the exact same experiences. But you know, it's interesting. So yes, the first of all, technically, you don't have to write a form to do a formal grievance, right? It can be verbal, but it's a way, if you do it verbally, then technically the nursing home is supposed to be documented. Well, a lot of times when you do it verbally, they never document it. You never get a written response, and it never makes it into the records. It's an easy way for them to, nursing homes don't like having any grievances on file for when the auditors come in, right? So they do everything to try not to have it in writing. They'll tell us, oh, you don't need to fill it out. Why do you want us to dealing with paperwork when we could solve the problem, right? We've heard that before. There are places where people can't find the forms. We have them outside our social worker. And I said, well, is anyone going to write up instructions on how to complete them? So that was another step. But there are places where they're behind the nurse's desk. And you have to ask a nurse or a CNA for a grievance form, and they'll ask you, why do you need this? Right? And then it's like, well, that's really not very helpful because it's not anonymous. And then sometimes they convince you, or they try to convince you not to fill one out. Right? So the location, or they ask you why. And, you know, we have to bring up the horrible subject of retaliation.
Yes.
I mean, I won't tell you who said it to me, but I was once told, well, I made a complaint to the state, and they said, well, you know, you don't want the nurses and aides thinking that you're a complainer to the state because they may not want to care for you. Now, that's a threat, right?
Absolutely. Yes.
You know, and there are more subtle ways they do it. Like they can delay getting your medicine to you. They can delay your CNA getting you up in the morning. They can be very passive aggressive about these things. But we do live in fear of retaliation in one way or another. And grievance system doesn't work. And, you know, we know it's better than not having anything, but we did a call with a bunch of volunteer advocates. And it was like, does everyone know that what their grievance policy is? And you know, people sometimes ask their social worker or the administrator, and it takes them days to find it. You know, it's like, well, shouldn't it be readily available? And it's not. And I bet you if the quiz, many places, staff, they don't know what the process really is. They have their version of what they kind of think it is or how they handle things, but it's not necessarily the way it's supposed to be done.
That's one of the requirements, is that the grievance system must be made available, and people must be made aware of how to file grievances. And I want to stop us here because Maurice is here.
Hi, Maurice.
Hello.
Hello.
How are you all?
It's good to see you, Maurice. Thank you for joining.
Thank you.
We all introduced ourselves at the beginning. It'd be great if you could just share your name, where you are, where you live, not necessarily the facility, but what state and how long you've been in long-term care. And then maybe you could also share with us about your experience with your grievance system in your facility.
My name is Maurice Miller. I live outside of Washington, D.C. in Tacoma Park, Maryland. I just celebrated my 12th year in this very facility. It's changed over. This is the second corporation to take control over it. The grievance situation is one that is fresh in my mind. As a matter of fact, I've experienced a situation where I filed a HIPAA request, know the statute well, with the social services director to get my actual plan of care, because this corporation basically is not following a plan of care with me. They refused. There is no point in me filing a grievance because I previously filed a HIPAA request with a former executive administrator here. He refused. He has since been promoted to the corporation. So that type of behavior here is essentially rewarded. Meanwhile, we have a new administrator here, um, who has assured the residents that we could set the bad behaviors of previous administrations to the side, that we have a new era here of cooperation and participation. She touted the fact that she became involved in nursing homes when she was 13 and volunteered for the first time and decided that she was going to make nursing home administration her career. I asked her in writing if she was going to, if the nursing home was going to follow disability law, making sure that I had private space regularly to communicate. I use vocalization software for everything because I'm a quadriplegic. They failed to do that, to give me a private space away from my roommate. I also asked them if they were going to give me private space with my therapist as is required by law.
Yeah.
Two basic yes or no questions. She said, let's discuss these things in your care plan and in the future. Why don't you just ask to talk to one of us and we'll come by and talk to you? I'm like, this is the same old that I've been experiencing. By the way, the last email I got, will you be following the law in a certain issue? He said, we would be able to do this thing more productively if we talked face to face. So I don't see any difference from the old to the new. And I don't see any reason not to document my care, frankly. So bad behavior here was rewarded. The grievance policy here is a crock. And basically, they literally have gone out to say, the less we document, the better. Fortunately, the state has successfully advocated in our behalf and said, basically, you guys are doing bad. I've documented several things here, filed several complaints with the state, and in every instance that I filed a complaint with the state, the facility has received a deficiency. So I'm quite content to continue documenting.
Yeah.
Thank you,
I don't want
Maurice.
us, even though we're kind of saying that doesn't work, it's still important to file grievances, because when the state comes out, at least in New Jersey, they go to look to say, was there a formal grievance filed? When was it filed? So if you do fill it out, ask them to make a copy, then they know it's from you, but that's going to happen anyway. So you have it. We did it about staffing, and the nursing home got a pretty substantial fine, and it did shake things up for PNA staffing. So we're not saying don't do it. It is frustrating. It doesn't work, but don't stop fighting, and don't get the state involved when you need to.
Yes.
Agreed. The
Agreed.
beauty of it is that when you file a grievance, if they are not going to break the law, they are mandated to document that grievance process.
Mm-hmm.
And right then and there, you have them on the hook. They are required to have a grievance process, and they're
Mhm.
required to document every part of that grievance process. Even if it's a sham process, they're supposed to document that sham process. And that's something you have in writing for the state to circle back on at an appropriate time.
Point out too that Richard put a very helpful one page of the LTCC has put out about the grievance system. And I think that's absolutely right. Um, you know, we could even file complaints about the grievance system, right? To the Department of Health. But
Okay.
that could even be frustrating as well, right?
Yes. Yes.
And before we move on, I want to move on to our last subject in a second. It just, I hear the frustration of having to live in a system that supposedly has all these safety nets in place when a lot of them just don't work, right? And how frustrating that must be. Because I want to move to our last subject here of staffing. I think we'd be remiss not to talk about staffing, and particularly lack of staffing in nursing homes, particularly since we all know that that's really at the root of most of the care problems. We're currently right now, as you're all aware, there was a minimum staffing standard implemented last year by the previous administration that's really at risk of being rolled back by Congress and in the courts. And uh, throughout this process, and I know as groups, we've tried to elevate the voice of residents, because that's the most important voice in the resident conversation. So Maurice, I wanted to start with you and ask about what's staffing like in your facility.
Staffing is very unstable. There are times, for example, when we see full staffing, such as when the state is in here doing a survey. Let's be honest. We were
True.
we were
True.
amazingly well staffed roughly a month ago when the state did its first annual survey since this corporation took over in May of 2020. Packed to the gills. There was an immediate drop off once we cleared survey, and there was a dearth of people. We were working short. Quite often, on many shifts. As a matter of fact, the new administration has committed to getting all of us in the dining room for meals. And the frustration has been that to get many of us in the dining room requires putting us in Hoyer pads and Hoyer lifts, getting us in there. And the staff has been frustrated because they're saying we're working short. And it's difficult to clean everybody, then get them in the chairs and them in the dining room when we're trying to clean everyone up in the morning. And it's a never no-win situation for them. Recently we've seen a lot of an increase in agency staff. So you get people who are unfamiliar with your routine. They come in and acknowledge they're unfamiliar with your routine. This leads to a lot of frustrations, especially when you have scheduled things you want to do. When there are times when you want to get up for scheduled situations, like I just mentioned, when I need to get up to get away from my roommate, to communicate privately, when I have a doctor's appointment that requires me to get up. So that throws you off kilter. I do not know from day to day how many people are going to be here, and if the people who are here are people I can trust to care for me properly. That's it in a nutshell.
And that's day to day for you.
Day to day.
And I just want to make one comment. It's really funny because I think Cindy will agree, because we've talked about this. They say that they can't find qualified people, but when the state's coming in, they manage to find them, right?
I don't know where they come from. I don't know how it happened.
But they vanished 2 weeks later or a week later.
Not even 2 weeks. I am serious. We cleared survey, and I think the very next week, all together, we were short on every shift.
Yeah.
It was amazing.
It's true. It is
Cindy,
true.
it sounds like what is your facility is understaffed as well? What's that mean for you and your care when there isn't enough staff in a facility?
Well, again, we are in our survey window, so have plenty of staff right now. Our corporate nurses here, other people from the corporation are here, just on standby. Last year, a survey happened on March the 22nd, so we are definitely there. But my main concern about staffing right now is the lack of staff that are able to help our residents eat. This nursing home, I believe, is probably 95% dementia, Alzheimer's, or people that just aren't capable of using a knife, a fork, a spoon. They definitely need assistance eating. And when I go to the dining room and sit there and watch people that have their food put in front of them, their utensils are still wrapped up in a napkin. They can't figure out how to open up the utensils. They can't figure out how to eat, and we don't have enough people available to feed them. When they finally do get to them, maybe their food is cold. It's been sitting there for 30 minutes or so, and they're just not getting the assistance. I started a family council in August, and the only thing we asked for at our last meeting was for people in the dining room to get help with eating. We have people that hire people to come in and feed their loved ones, and that should never happen. Fortunately, they can afford it, but most people can't afford to have somebody come in as a private caretaker. So it's a huge problem.
Right, same question to you.
Yeah, I think, yeah, of course, I agree with we have the same problems and everyone else does. But I think when you think about it, is if you don't have consistency in your CNAs and nurses, especially with people who can't communicate, they're the people we trust to not only care for us, but know us. So if our condition changes, right, or we start developing a sore, or, those are things that our aide and our nurse has to spend some time with us, know us, so they can react to it. Our nurses, and I don't need this anything bad about them because I love them, they've turned into pill pushers because they're not given time with us. And, I will tell a story of one of my roommates who had MS, and he got to the point where he couldn't communicate. And I kept saying over the weekend, he's really not doing well. And it was an agency nurse, and she was a good nurse, but it was like, yeah, she didn't know. And then Monday morning, when his regular CNA came in and the regular nurse came in, he was off to the hospital, right?
Yeah.
Because they knew it. But if they don't know us, it's tough. And we have agency CNAs, but then the management doesn't want to manage the agency people. They don't brief them on us before they get thrown into the fray. So they get frustrated. It's poor for resident morale. It's bad for staff morale. They're overworked, right? They're tired.
Yes.
And it doesn't seem like management really has the skills to manage the resources and match the right CNA even up with the right resident. So it causes more frustration and more wasted time.
True.
And Sam, I'll give you another example. One of the other problems is misallocation of the resources. Let's be frank, there are, in some cases, residents who are here, even though they're in my facility at least, who should not be here because of the challenges that they bring. We are not a skilled facility for people who are high maintenance, for lack of a better term, memory care residents. I describe that as people who are a safety risk to themselves. We have a resident here who is very strong, but who wanders about nonetheless throughout the facility, is at risk of falling because he will stumble over anything in a resident's room. Yes, he does wander in resident's room. And periodically, when they try to change him, he actually hurts the nursing assistants. The nursing assistants frequently have to double up to try to guide him back to his room or to guide him to safety. So that means that they have to like commit one or two or three people just to him because the facility is committed to taking his money rather than appropriately um, sending him to a properly skilled facility. Now, the problem is when you, like I said, you have too many resources allocated to that one resident. At the
Mhm.
same time, when you do have dedicated people who are just watching out for that resident or just keeping an eye out for that resident, what happens when the facility says, don't look out for the resident, ignore him, only allow one person to take care of him, and everyone else go about their business? And the administrator says, everyone is allowed to fall. Then immediately you're prone to a lawsuit whenever he finally falls. So either way, you're misallocating your resources because the facility is committed to ripping that poor resident off at the sake of his family, loved ones,
Mm-hmm.
and risking risking the health of all of us other residents who
And more,
cannot afford that.
I wonder, we we bring this up at resident council and they treat us like we're bad people. We're saying that, we don't want these people to fall or get hurt.
Mhm.
And to be honest, if they had the right amount of people they had when the state was here, they could give that person the resources they need. But they're running so thin, and then they have to dedicate those resources. And they know when they take the people in, they don't have the resources. But as you're saying, they don't
Or
care.
the training, or
Right.
any training.
Yep. The skill set. Yeah.
It's pretty shocking to think that they can staff their nursing homes when they need to, when there's government oversight in there. And suddenly there isn't a staffing shortage, right? There aren't inadequate people to hire.
Mhm.
But we all know, unfortunately, that many nursing homes, that's how they make their profits, right? Is off of um understaffing facilities.
Mhm.
Um uh One thing, is there anything else you guys wanted to say, any of you, on the staffing issue? Although we could probably devote 2 hours to talking about
I was going to
understaffing
say, but yeah,
in nursing homes.
we want to give time for questions too.
Yeah,
Yes, definitely.
one thing I would say is the staffing issue hurts staff
Mm-hmm.
because when
Right.
the staff works short, they're trying to do extraordinary things and they're hurting themselves. We have a lot of working wounded or staff who try to do too much because
Mhm.
they don't have enough help. And we
Yep.
have a lot of people who have injured themselves on the job and obviously can't apply for workman's comp because it's a bad phrase in this facility.
Mm-hmm.
But
Do
that's the
you-
risk, that's the other risk.
do your facilities offer workman's compensation for your staff members?
The old corporation they did, but it was a pain to try to get. And
Yeah.
I have a good friend who used to work as a nursing assistant who ultimately was turned down. And by the time she got surgery, it was too late. She lost the use of her arm.
Ours does not offer it, nor do they offer any kind of um, maybe back braces or any kind of training on how not to get yourself hurt.
Mm.
And again, we go back to the issue again where they're not using two people to do the Hoyer lift or the
Yep.
sit-to-stand lift. They're still just using one person. So even though it's mandated that it's two people. So
Well, and sometimes, especially in the night shift here, the people who are working, if someone gives them trouble or they fall, no one's strong enough to pick them up. So they do hurt themselves,
absolutely.
right?
We're getting to the end of the time, and there's one question in the Q&A that I really like. Well, there's a lot of them that I really like. But the question is, I mean, we have you're three of my favorite folks. You just happen to be nursing home residents. How can we organize residents to get better change? What can we do as a society to advocate with you to try to make this better? And you have to answer this in under 3 minutes, Cynthia.
Oh my
I'm just
gosh.
kidding.
I
Oh,
have.
this for the last 7 years, and I still haven't come up with an answer. We've tried everything. We've tried, we, my family council gives a $50 Visa gift card to our caregiver of the month, somebody that we want to acknowledge is doing a good job, one that goes over and above. People that aren't on their phones, scrolling on the phones while they're trying to sit with somebody and feed them. We just see them scrolling on their phones. I mean, there's just so, I don't know if it's just the workforce that we have now. How to get people to be empathetic, how to get them to realize that this could happen to you or your
Mhm.
loved one. It's not something that is just older people. People think that nursing homes house old people and that we're all here just to die. That's not the case,
Yep.
people. There are young people in this facility that are going to be here. My daughter will probably live here for the next 40 years. She's already been in here for 7 years. It's just it's not for old people any longer. And you have to realize that it could be your daughter in here.
Mhm.
And would you want your daughter to be left in this kind of situation? No, I guarantee you would not want your child to be living in a nursing home under understaffing, under possible retaliation for commenting. Our family members are scared to make comments or
Mhm.
file a grievance. It is it is it is challenging.
And
And
I
don't know what the answers are.
I will just say one thing is don't, you're right, speak for us, support us. And I think
Yeah.
that's a lot of times they just, they were like, oh, well, we know what the resident wants and we're going to speak for them. And we had a person, a department head that did their goals and they really impacted us and didn't bother asking the residents. Like, but when I go to church or I go in an organization and like any of us who are pretty articulate, we talk to people, they're appalled, and it's like, I think of, we live behind a wall. People drive past nursing homes, but they really don't know what's going on behind here. And when they do, and when you can shed the light and let us tell a story, people are sympathetic.
Yeah.
But they don't know what to do. They don't know how to help.
Right.
That's the problem. Nobody knows how to help.
One thing I want to point out, and we need to wrap up here, is voices do matter. If you contact your local and federal legislatures, they do matter. Too often.
I live in a red state, Sam.
Right. Well, you'd be surprised. Too often we can't give up.
Mm-hmm.
We can't give up. And too often people don't contact their legislators because they think that they live in a red state or it won't matter. But the silence that the legislators hear is just as loud, if not louder, than your voice when you do reach out. I want to thank you three. We have to wrap up here, and I want to turn it back over to Richard. This we're really grateful to you three, not just for advocating for yourselves, but more importantly, and I think we hear it in your tone, is how you're advocating for all nursing home residents. I hope you read the comments and the questions in the chat, and you see just how supportive folks are. And thank you, and thank you, Richard, for having us today.
Well, thank you all
Thank
very
you.
much. Thanks very much. Yeah, you guys were wonderful. And we'll try to, I think we could print out the chat and we'll try to do that and share that with you so you can see what everyone said. I just wanted to quickly as we wrap up, just mention that our next webinar, actually, I think will be of interest to a lot of people on this program as well. It's on privacy violations and abuse, the hidden dangers of social media in nursing homes in particular. Sometimes care staff will use social media, like take Snapchat pictures, of residents who may be undressed, etc., or in an embarrassing way, and then post that on social media. So Professor Elan Caspi, who has done some really excellent research in this and in other areas related to retaliation, which we've talked a lot about today, of course, and this issue, will be discussing his work, and he's a very thoughtful presenter. I hope that you'll join us. But thank you all very much. Thanks for joining us today, participants, but just my sincere and heartfelt gratitude to our residents today and to Sam for this conversation, which I think is so important. I know a number of people, before we close, a number of people in the chat I saw were interested in, are there are there national groups that are doing this, or national conversations, I should say, of residents? And as Sam said at the beginning, they have a advisory council of groups. I certainly urge people to get in touch with, to check out the Consumer Voice. It's theconsumervoice.org for their resources for residents and to connect. And some states do have statewide resident councils. I would check with your long-term care ombudsman to see what opportunities there may be there. But again, thank you all very, very much. We really appreciate it. This recording will be up, I think, by the end of the week. So you're free to share and share the recording and to view it again with others. Thank you so much. We really appreciate it.
Thank you.
Have a nice day, everybody.
You too.
Thank you.